For more, I'm joined by John Moore. He's a professor of microbiology and immunology at Weill Cornell Medical College. Professor Moore, great to see you. What does January's devastating death toll tell you about the upcoming weeks here in the U.S.?
Well, it's pretty awful, wasn't it? Nearly 100,000 dead Americans last month. Well, the good news in one respect is that infection rates are now declining, and hospitalizations are also decreasing as we seem to have worked through the Christmas and holiday period, New Year's surge and the travel surge. But there's still 100,000 people in hospital, and death rates lag behind infection rates by a couple of weeks. So we'll still see 3,000 people dying a day for the next few weeks. Maybe then we'll see a brief decline, but the new variants are a concern to us all because they're more transmissible. They seem to be spreading increasingly rapidly between people, and the concern is that they will become the dominant strains in America, and that will then further increase the infection rates, hospitalization rates, and death rates. So we have a lot to be watching and planning for, I'm afraid.
So talk to us a little bit more about these variants that are quickly infecting people in more than a dozen states. How closely are they being watched, and what impact could they have on the country in the coming months if it does look as if they are becoming the dominant strains, I should say?
Yeah, we've not been terribly good in the USA about tracking new variants. It's been done much better in the UK. The Europeans are not very good at it either, but we're ramping up capabilities in this area. The monitoring, the sequencing of virus strains is becoming more and more intense so that we can get a handle on what is to come. But they do seem to be spreading. They're now found in essentially all states. I mean, if they're not found in a state, it means they've not looked hard enough at this point. And as I say, they're more transmissible, so you're more likely to become infected if you come into contact with a person bearing one of these strains. So we have a lot to watch out for, I'm afraid.
And how much will vaccines, if we continue to get them out and maybe speed up the process, how much will that help control the new transmissible strains, and will other measures need to be taken to stop them from spreading?
Yeah, there is a race of sorts between getting as many people as possible vaccinated before these variants spread even more. So the ray of good news in this is that most of these variants we think are not going to affect the performance of the approved vaccines, the mRNA vaccines that have been approved. There was a successful trial of a protein vaccine last week, and all the evidence is that most of these variants are still dealt with by the vaccines just as well, or with only a minimal effect, so that we're not going to see a vaccine catastrophe with most of these variants. Now, there is one that is troubling, particularly troubling. It arose in South Africa. There's a cousin of it in Brazil. It's starting to be seen in the States, and that one could reduce the efficacy of the vaccines. Not catastrophically, but to an extent, and it's an extent that we would rather not see happen. So again, that virus is going to be monitored particularly carefully, and we just hope it doesn't become a dominant strain because it is the most problematic one we've seen so far.
Now, when it comes to the vaccinations, Professor, New York City Mayor Bill de Blasio says there is a profound racial gap in the city's vaccinations thus far. You are also here in New York City. Why do you think this is happening, and what effects do you think this will have on the city's progress in containing the virus?
Yes, I'm here, and it's snowing just as much on the Upper East Side as it is on the other side of Central Park where you are. We're all in the same storm. But we're all in the same storm from the pandemic perspective as well. And the mayor is quite right on this one. There is a racial disparity. I mean, America is rooted in racial and economic disparities, and it's always the poorer and the minority people who get less access. Richer, well-connected people seem to be finding a way to get the vaccine, to jump the line, to get ahead of the game. And I'm afraid that's always been the case. And we need to address this on multiple levels. Even simple, relatively simple-sounding things like internet access, filling in online forms, which if you're a senior, these forms are quite difficult. I mean, I hate online forms. I struggle with them at times, and I've got a pretty good computer system, and I'm reasonably well educated. So imagine an 85-year-old woman in a limited internet facilities grappling with how to get an appointment and then schlepping across town, perhaps in bad weather, to line up to get an appointment. These are problems of inequity and that need to be addressed. And it's a very serious problem, because if we don't deal with the virus in the communities where it's spreading the most, everyone's affected.
So true. Professor John Moore, thank you so much for joining us. We appreciate your time.